I want to introduce you to Erica Carey. Erica is a surrogate from Portland, Oregon, and just flew in today. Erica, welcome to Chicago.
Thank you.
Yeah. And let me ask you a couple questions about your background first.
Sure.
General questions. Can you give me your address and where you're from originally and where you're living now?
I was born in Portland, Oregon. I was raised in Colorado and then moved back to Portland in 2002. My address is 17338 Northeast Wasco Street in Portland.
And can you tell me if you've been a surrogate before?
I have not.
Okay, so this is your first time?
Yes.
Can you tell me about your pregnancies, how you felt about the prior pregnancies?
I've had 4 children, and we have had fantastic pregnancies each time, uncomplicated.
And tell me, if your children, tell me their names and how old they are.
Hunter is 12, Grace is 9, Sean is 4, and Henry is 2.
And during the pregnancies for your 4 children, or during the pregnancies, let me say, did you have any particular symptoms that were unusual during the pregnancy?
No.
What kind of symptoms did you have?
A little bit of tiredness in the first trimester, a little bit of morning sickness, but nothing terrible.
Were there any complications during the delivery?
None.
Did you have a natural delivery or a C-section?
Natural, all 4 times.
And tell me what you're doing. What's your occupation now?
Right now, I stay at home with my children.
So you're a full-time mother?
Yes.
Okay. And tell me about your educational background. Did you graduate from college, high school? What's your background?
I graduated from college with a bachelor's degree in community health education from the University of Northern Colorado.
And what year was that?
2002.
Okay. And did you work after you graduated, or did you become a full-time mother?
I went to work after I graduated. I stopped working in 2009 when my youngest was born.
And what was your first job after graduating from the University of Northern Colorado?
I moved to Portland and became a med aid at an assisted living facility.
And who'd you work for there?
Altera Healthcare.
And after you worked at Altera, when did you start working at your second employment, and what was it?
In 2005, I started working at Providence Portland Medical Center.
Okay, what did you do there?
Patient transportation.
And why did you quit, or what happened after working at the Portland Medical Center?
When we got pregnant with our 4th child, we decided it would be more beneficial for me to be at home full time. Do you have insurance to cover your surrogacy pregnancy? Yes, I am insured through my husband.
And what are your values as a surrogate mother? It's coming up.
I don't know if they'd be any different than my values just as a person every day, and that's to be honest and open and truthful and try and help people. And as a surrogate, it would be very important for me to take care of the child that I was carrying like I would if they were my biological children.
Is that the way you raised your children, the 4 children you have?
Absolutely, yes.
How do you take care of yourself now in terms of your health?
I don't smoke, I don't drink, I don't do drugs. I try and eat healthy, stay pretty active. And
in terms of staying healthy with your eating and staying active, how do you do that?
As a family, we don't eat out. We cook our meals at home. We try and eat. My husband is a produce salesman, so we have a lot of fresh produce at home at all times, and we stay away from the processed foods. And
I think you said your husband was a chef at one time too.
He was.
He must be a good cook.
He is.
But tell me about his cooking. What's he do?
Well, he got his degree in culinary arts, and so although he prefers baking, so that's not so healthy, but he doesn't do it very often. But he just is a great cook, and he's real good at. We've in the last few years we've kind of evolved into more of a healthier way of eating. You know, we want our children to be healthy too, and so he started cooking more healthfully.
And what kind of activities do you do in terms of keeping your health up?
Oh, Well, our children all play sports, and so we're, active in their sports teams and going to their games. And we just bought a new house, and we've been spending a lot of time walking and exploring our new neighborhood. And
can you describe your diet on a typical day when the last time you were pregnant? The last time you were pregnant with Henry, what was your diet like?
Lots of fruits and vegetables, drink lots of water and whole grains, and follow doctor's orders. And
How do you feel about the role of being a surrogate for a couple who desperately want a child but cannot conceive?
I think that giving a child is the greatest gift you can give anybody. I know my children are by far the most important thing in this whole world to me, and I can't imagine my life without them, and I can't imagine not being able to experience the joy that our children have brought us over the last 12 years. So.
You've been pregnant before, I think you said, and I'm sure you realize that very often there's maternal feelings, and also you end up with sickness, vomiting, and even faintness through the course of a pregnancy. Do you have a plan to deal with these feelings of being maternal and also these physical issues that can arise?
I have a really strong support system, and I know that my husband will be fantastic at helping out, around the house. We have a lot of grandparents that live nearby that can take the other kids for me if I need a break, if I need to rest. And, I'm kind of a roll with the punches kind of girl, and we'll just take it day by day, and I don't anticipate any problems. But
can you describe the relationship you have with your husband, kind of generally and then specifically, whatever you want?
His name is Patrick, and he is fantastic, and we've been married for almost 7 years, together 8 years. We have a very healthy, solid marriage. He's a very hard worker, very dependable. We have pretty traditional roles in our marriage where he works and he supports us, and I stay at home, and we just, I think, have a great marriage.
Do you have any reservations regarding the legal relinquishing or giving up of the parentage of the child after the birth?
Absolutely not. We're done with growing our family.
You're done growing your family, meaning you've had enough of your own children.
Absolutely.
And now you just want to help others.
Absolutely.
Okay. Should more than one embryo be implanted and all of them succeed, what are your feelings regarding fetal reduction or abortion if it's the couple's wish to have no more than one child?
I strongly feel hesitant to agree to have an abortion for selective reduction reasons. I would be very open to it for health reasons, but just to selectively reduce, I would have strong reservations against it.
So that means you'd like to have all the children that you're impregnated with. Why don't you tell me about that a little bit?
I would prefer to only implant the number of children that the intended parents would like to have.
Or
if they were,
oh, go ahead.
I would be happy to carry twins, and so if they would like to implant 2, I would like to carry 2. I would not like to implant 3 in hopes of only carrying 1, kind of thing.
Mm-hmm. What are your views on health during the pregnancy?
I think it's very important to take care of yourself and make sure you're getting rest and eating well and being mindful that everything you put in your body you're giving to the baby as well, and be aware of the fact that you're, growing a child, and be as healthy as you can be.
Will you strive to eat a healthy diet or reach out for support if you need to? That's a 2-part question. Healthy diet and support.
Yes and yes.
Okay, tell me about it a little bit.
I will eat a healthy diet like I did in the past. And like I said before, we have a lot of support with our families and friends who would be more than willing to help.
should you become overwhelmed and morning sickness or other reasons that may prevent you from getting the proper nutrition you need, how would you answer that if you became overwhelmed with morning sickness or other reasons that may prevent you from getting proper nutrition that you or the baby need?
I would talk to my OB about that. I know that sometimes women...
Your doctor, your OB doctor. Yeah.
I know that sometimes women can have severe morning sickness and have to be put in the hospital, with IV fluids and stuff. But I would keep in contact with my doctor. And
do you have a solid support system from your family to help you face the feelings that may be overwhelming?
Absolutely. They all know that I want to do this, and they're all very supportive and on board.
Tell us about all the people in your support system.
I have parents who live about 20 minutes away. I have grandparents who live about 10 minutes away. My husband's side of the family is also in the area. Lots of friends, family, 3 sisters, a nephew, brother-in-law, aunts, uncles, cousins. They're all there.
Are you willing to work with the surrogacy agency, IVF doctors, OB/GYN doctors to take all the necessary tests and screening to be qualified and to travel out of state for necessary operations?
Yes.
Okay, why don't you tell us about that?
I would be willing to do what I have to do to be successful at this.
Are you willing to work under surrogacy support staff's instructions to provide all the data information that is requested by the client?
Yes, I will do what I need to do.
How do you see yourself in the bigger picture of the gift you're giving to the couple? You talked about this earlier.
That it's the most wonderful gift one could give, and that's life and being a parent.
So do you have any desire to have any future contact with the child as he or she grows into adulthood?
I think I would leave that up to the child, what they feel comfortable with, and also their parents, and respect the parents' wishes on that.